So, hello and a big warm welcome to everyone. My name is Marion Rose, PhD, and with me here today I have Aletha Solter, also PhD, and we're here as part of our conversation series to talk about aware parenting. And today we're going to be talking about limits, loving limits. So, welcome, Aletha.
Thank you. It's good to talk with you again.
Yes, so I'm so enjoying our conversations. So, loving limits or limits, what are what are they? That's the first question I imagine lots of parents ask. What are limits?
Yeah, big, important question. First of all, before I say anything else, I want to acknowledge you for the term loving limits. You coined that term, I think, and I kind of stole it and used it in my, I use it a few times in my book, Cooperative and Connected, and because I like the term so much. Before that, I just talked about limits, but just talking about limits, you have to set a limit. You know, it sounds harsh, it sounds authoritarian, and that's not what we want to be doing. So loving limits, I like that term. I mean, it's loving. It's the loving part. We're connecting. We're showing empathy to the child. We're, acknowledging the child's feelings. But there is that limit there too. So it's two components to it. So thank you for the term. Yeah. So I think I just kind of defined it too, didn't I? Yeah, well, we can't let children do whatever they want. Okay. I think we all know that. I think the question is how to stop them, how to set these limits in a way that doesn't damage our relationship with them, doesn't make them feel bad.
Yeah. And I think it takes us further into the whole piece around it, which is why do children sometimes do things that we might want to set limits?
Right. Yeah, exactly. So exactly, we need to delve beneath the surface and figure out why they're acting the way they do. And part of it may be lack of information. A big reason is often that they have pent-up emotions, accumulated stress, unhealed trauma, and they just need to release that either through laughter or crying, one of the main tension release mechanisms. So when we think of it that way, when we think of their behavior that way, it does make it easier to find a way to set the limit lovingly, rather than thinking, oh, they're just misbehaving,
Exactly.
You got to teach them who's the boss, and no TV for you if you keep acting like that. That's okay. That's when we kind of don't really understand why they're acting the way they do.
Yeah, and I love your model. I quote it probably 3 times a week. The 3 reasons for children's unenjoyable behavior: need for information, unmet needs, or pent-up painful feelings. And really,
right, yeah,
the 3rd reason, aren't we, in terms of loving limits?
Very often, yes, yeah. So, one main thing that we need to set limits for is when children are acting hurtfully. When they're acting hurtfully with other children, when they're throwing blocks at the window, they're hitting other children, they're hitting the baby, all that kind of very disagreeable behaviors. Sometimes we just need to step in and just stop them physically. So I make an important distinction between the use of force and the use of violence. Force, loving force, okay, to keep everyone safe is very different from violence. And sometimes we need to restrain their arms, legs, if they're using them to hurt someone. Sometimes we need to just give them a loving hug, gather them into our arms in a loving embrace to kind of stop them from doing what they're doing. Sometimes we can say no, but often for aggressive behavior, we sometimes need to just stop them physically. And it's okay to use our strength if we do it lovingly and not hurtfully. We're not going to hit them, obviously. So, yeah. And then when what were you going to say?
What I love really about your approach, about the aware parenting approach, is that the whole paradigm is a completely different paradigm from, what I call behaviorism, which is the reason children are doing these things is not because, they're bad or they're misbehaving.
Right.
They're asking for it or they're deliberately being annoying. And And likewise, we don't need to respond in those old paradigm ways. We don't need to respond with harshness or punishment or punitiveness or threats or disconnection. We can actually respond with limits that are loving, that actually provide behavior.
Yeah. So, yeah. So I tell parents, don't be afraid to just intervene physically if you need to. It's okay. Your job is to keep your children safe, to keep other people safe, to, if they're trampling the flowers, you need to do something. Tell them to stop. Explain why. Explanations are important, but children don't often respond to just no or stop. And so sometimes, especially young children, but sometimes we just need to stop them. Yeah.
And I often find when I start to explain loving limits to people and they kind of go, yeah, but my child doesn't stop, they keep doing it. And then, they must be misbehaving. And to really understand that the way I explain it is we're saying no to the behavior, that we're saying yes to the underlying feelings that are causing that behavior. And the love actually gives the foundations, either with the, I'm not willing for you to do that, I'm going to stop you, and the explanation. But we're giving them love, and I'm here and I'm listening to actually, so that the underlying feelings can be expressed instead of the hitting or the pulling the flowers out or whatever it is.
Yes, I like that, saying no to the behavior, but yes, I love you, and the yes to the feelings underneath the behavior. Yeah. Very important distinction. Yes.
So they're probably not going to just go, oh, okay, then yes, I'll stop hitting, I'll stop.
No.
They're going to start maybe doing more, and they may be trying to pull out more flowers, or maybe.
Right. Yeah. Right. Yeah. So there's another piece to this whole setting limits that I consider very important. And that's when children, they're not necessarily aggressive, but just doing something. They're really demanding, maybe disruptive, agitated, acting rude. And those are times when they often need a pretext to start crying. And sometimes our limit can help them start crying. And again, we can use a physical limit. We can hold them. We can use play. Limits can be playful. We can say, okay, looks like, I need to find the off button here. That's one of my favorite. Just pretend they're a machine. And this age of devices, that they connect with that idea. Okay, the on button, the off button. So is the off button? Is the off button? Is it here? Is it here? Is it here? The young children, they will surprisingly stop their behavior after a while when you've found what they've decided is the off button. So there's just lots of playful ways to do that. But I think one of the most effective ways to set limits in those kinds of situations is to limit ourselves, to limit where we're willing to do for them. And that's a piece that a lot of parents don't always think of. And it took me a while to get to that concept. I mean, it's okay to say, if they're demanding, I want the blue cup, and it looks like they're on the verge of, they're worked up, and it looks like, there's tantrum brewing or ready to come out, or they just need to release some emotion. It's okay to say, I'm not really, the blue cup is in the dishwasher. I'm not willing to get it out and wash it by hand for you, but here's the red one. So we're limiting our own behavior.
Love that, yeah.
We're not trying to get them to change. We're just saying what we're willing to do. We're not willing to do that. Or a child is, let's say you're walking, going for a walk, you're carrying your child, let's say it's a 2-year-old, and your back starts to hurt a little, and they're kind of fussy and demanding and squirming around. It's okay to say, my back hurts, I'm really not willing to carry you anymore, but I'd be happy to hold your hand while we walk. Well, when we do these kinds of things, though, we have to be ready to go into listening at that point. We have to be ready for the crying that will probably happen.
Yeah.
And I think this important piece of limits is, again, setting limits on what we're willing to do. Yeah, no, I'm not willing. This is going to be the last story. I really don't feel like reading any more stories tonight. And we can use that, obviously we use it at times when it really is, a real need of ours, but we can kind of, set these limits on ourselves too when, sure, we could read another story, but when we feel that the child needs a pretext, or the child, so we create this broken cookie, the broken cookie phenomenon, a pretext to cry. Yeah.
And what I love about that is, when we're looking at those 3 reasons for the unenjoyable behaviour, and we're initially thinking, well, this is probably going to be a need. I've got the birds coming in, so I'm going to put my headphones in. If we're going through your 3 reasons and we've given them information, they're still doing all this stuff, and then we've met the need and tried to do what they say, and they're still acting in unenjoyable ways, then it clearly tells us that that actually isn't an unmet need. So then we can go to the loving limits. So I think that can also give reassurance to parents.
Yeah.
But maybe it's an unmet need, and maybe they really need to be picked up. But if we do the thing and they're still avoiding eye contact or having a whining voice, all of those things, that usually indicates it's feelings rather than an unmet need.
Yeah, I use kind of a rule of 3 here to just I advise parents. If you've met your child's very demanding and whiny, and you've done like 3 things to meet their need, and there's still nothing's right.
Yeah, I love that.
Chances are, obviously not every situation you can use a rigid rule, because we don't want to miss real needs. Obviously.
Yeah, of course.
But they want the red cup, and that's not right. Then they want the blue one. Then they whine because they want you to cut up their potatoes, and you didn't cut them up right. And then they didn't want that green stuff on their plate, and it can go on and on. So after a while, we say, oh, maybe I just need to say, no, I'm not going to do that for you.
Yes.
And then they'll have the cry that they need to have.
Yeah, because it isn't actually an unmet need. And I think that probably takes us into the next piece that you're talking about is the topic of permissiveness, which is we're constantly thinking it's an unmet need and doing, and they're getting more and more whiny and more agitated and asking for everything and never happy. That can be one of the consequences, can't it? Do you want to talk more about that?
Yeah, permissiveness. This is when we don't set necessary limits, and that, I think, parents. Some parents find it difficult to set limits lovingly, so they don't, because they didn't have the role models, and they don't know how. We're not born knowing how to do this parenting thing, and so they might not set limits. They might worry about hurting their child, or they think they're remembering that limits were set harshly for them, and so they don't dare set them. Also, I think there's a fear of tears and tantrums.
Yes.
I think that some parents kind of tiptoe around and try to keep our children happy all the time. I call it the happiness trap. We're not, our job is not to keep our children happy at all times. Our job is to meet their needs.
Yes.
So I think that's a pretty important distinction.
Yes.
And part of meeting their needs is
including the need to express feelings, release pent-up feelings. Yeah.
Exactly. Yeah. So, but when we fail to set limits, they can become very demanding. That continues. They never get a chance to cry because there's never that limit, that they don't have the pretext to cry about. It can also damage our relationship a little bit with them. Because we're going to become resentful.
Yes.
We carry them when our back hurts.
Yeah.
We read 10 stories when we really don't want to read.
Yes.
If we wash every cup by hand, just because they want it right now, we're going to start to feel resentful.
Exactly.
And so that's not good.
Yeah.
And that they're going to get confused. They're going to get anxious. Oh, mommy's resentful. Mommy's a little impatient. What have I done wrong? It can get kind of difficult. Yeah, so it's better to be authentic. They need us to be authentic.
Yes, I love that.
Yeah.
Because I think parents, so there in other paradigms of parenting, often hear you need to be consistent. And I always say, no, this isn't about consistency. This is about authenticity. Sometimes I may be willing to do 4 times, and other times it's going to be 2 times where I'm actually going, I think this, you need to cry here. I think this is feelings. I'm not going to do the 3rd thing.
Yeah.
I love that authenticity.
Yeah. The children feel reassured when we are authentic, when we're honoring our own needs. It's reassuring to them because things make sense. They see our facial expressions consistent with the message we've given, and that everything's clear. Because if we, go ahead.
Yeah, well, I remember you saying, and I wonder if you'd say a little bit more about that, because I remember you saying that sometimes children will keep on doing the unenjoyable things because they're not getting that consistent response from us. They're hearing. So would you say more about that?
That is one reason, one of the many reasons why children test, test, in quote, they test the limits. They test limit. They may be looking for that authenticity from us. And what does mommy really need? I sense she's saying yes, and I see no on her face. And, so they need that from us.
Yeah. That's so beautiful, isn't it? Because it's so different from that the behaviors and paradigm that they're doing it because they're trying to rile me up, or they're naughty, or they're misbehaving. It's actually they're wanting us to be authentic. They're inviting that from us. It's such a beautiful way of seeing children.
Yeah. So they're essentially saying, I'm confused here. How far can I go so that I get something genuine from my parents here, some genuine, clear-cut reaction.
Yes.
Yeah.
Which is a very different perspective, isn't it, from they're doing it because they're just seeing how far they can get away with things, or whatever that.
Yeah, right.
And just as we're coming to an end here, I'd love to hear, people often say, well, children just generically need boundaries. And, would you say something in response to that?
Yeah, I've heard that a lot. Children need limits. I don't think children are born, I don't think there's an inherent need for limits per se. I mean, I think setting limits can meet other needs. Like we've talked about, the need for authenticity. It can meet their need to cry when it's a loving limit and it's not a genuine need.
Yes.
So it can meet their need for information. No, I can't let you do that. I can't let you grab that glass figurine at our friend's house. It's breakable. I need to take it away. So they get information. So there are other needs that are met by setting loving limits. But to say that children just need limits, it doesn't make sense to me. Yeah. How about you?
Yeah, to me, loving limits, it's within a context, isn't it? It's within a relational context. They need limits for those reasons, but not just some random kind of thing that we decide there's a.
Right. I mean, we're in a relationship with it. It's like we wouldn't say to our partner, my partner needs limits. I mean, even though we might think that, we need clear communication from us. We need conflict resolution. We need to state our needs and our feelings. And we're not setting limits in that way. We're communicating.
Yes. I love that. Yeah. I'd love to say one last thing. It took me quite a while to learn loving limits with my daughter. I don't know if you remember, I had the picking up thing that I would always pick her up, and it took me a long time to really, it's often a feeling I find for me in my body when I really, the confidence that this is, they're going to be fine, and actually they need this to release the feelings or to get the consistency. And it took me practice. I'm wanting to share that in case people are going, well, I don't quite know. Sometimes we'll be I find it a bit not enough with the limit and too much with the compassion, and other times maybe a bit too much limity. Not often that way, but it takes time to practice. So
it does. And we're not going to get it right all the time. Nobody gets it right. We're going to miss real needs. We're going to miss opportunities to help them cry. We're going to self-sacrifice. And when they're babies, you have to self-sacrifice. You have to wake them up and feed them in the middle of the night. It's just that needs to shift at some point. We need to stop the self-sacrifice. It's hard. It's hard. Setting limits is hard for those of us who weren't raised this way, and I certainly wasn't. So,
Yeah.
yeah.
So thank you so much. Well, thank you for bringing this paradigm into the world so that we have the clarity. That's what it is. That's what's going on. And that's what I can do. So thank you so much for your work. And I look forward to our next conversation.
Yeah. Good talking with you.
Yay. Thanks. Bye.
Bye.